Hi, Regina. My name is Linda Walker, and I'm a Master of Science of Nursing program, and I need to interview an advanced practice nurse for my program.
Okay.
And do you agree to be filmed for this?
I do.
Excellent. So I have a few questions for you
Excuse me.
that will help us, learn a little bit more
Sure.
about what we're in class for. So the first question I have for you is, state who you are and a little bit about yourself.
My name is Regina Dowling. I am a nurse. I've been a nurse for almost 30 years. I grew up in Long Island, which is on the outskirts of New York City. I've been married for almost 40 years, have 2 children and 6 grandchildren.
Excellent. Second question I have for you is, what is your education? Where did you go to school for nursing? How long you've been a nurse? And what areas of nursing have you worked in?
So, I originally started in nursing back in the mid-90s. I went back as an older woman. I started in an associate's program in STIC, which is Springfield Technical Community College, which was a wonderful school. They really treated us well. We did a lot of bedside nursing, the associate's program. I waited about 10 years, then I went back for my bachelor's and then straight into my master's. I didn't want to stop again. And I actually just graduated my master's about 5 years ago.
Excellent. And what areas of nursing did you work in?
I started off on a floor as a new nurse. As a brand new grad, I wanted to get the experience down pat. I moved into coronary intensive care unit. I basically was an open heart nurse for 10 years after that. And then I went into what is called a clinical resource coordinator role, which basically is a nursing supervisor, a triage person, part of the rapid response team, part of the Code Blue team. Triage out of the emergency room into beds within the hospital. We moved people around the hospital that became critically ill, and staffing.
Excellent.
Oh, and okay. We'll
Go
get
ahead.
to that.
Okay. Says, question 3. How did you decide on being a nurse? Was this your first profession, or did you work in another area before nursing school?
So how I decided to become a nurse is kind of funny. My sister, when I grew up in New York City, we grew up, it was basically like the working girls. If you ever saw that movie with Melanie Griffith, and everybody got on the train and went into New York City after high school to work. Basically, that's exactly what I did. My youngest sister took a different path. She became a nurse out of high school. She went to college. And it actually surprised me that someone had gone outside that role. She became a nurse. I was very proud of her. I decided at that point, at some point in my life, at that point I was married with 2 children, I decided to become a nurse.
Excellent. So that was my next question, what path you took to become a nurse. And you went straight to nursing or took other paths. So you already answered that question, yes. So that helps out. So question 5, how did you decide to become an advanced practice nurse? And you already talked about your role at this time. How did you become an advanced practice nurse?
So as a clinical resource coordinator, it was a very stressful job. I decided to go into a master's program to kind of further my work. I went into a clinical nurse leader thinking that I would head a program of sorts in the hospital, that's exactly what I did. I became a clinical nurse leader. My degree came from Sacred Heart University in Bridgeport, New York, and I became the coronary artery disease program coordinator at the hospital where we work now. That consists of a lot. We began seeing open heart surgery patients. We wanted to see them from the beginning to the end of their surgery, even post-op. So we started off creating a preoperative open heart surgery pre-admission testing center, which is working well. We look for high-risk patients for the open heart population, and we would like to medically optimize people pre-surgery.
Excellent. And do you have any professional affiliations, and do you participate in them?
I do. I am the president of the Connecticut Preventative Cardiovascular Nurses Association, which is a national organization, PCNA, which is the national headquarters is in Wisconsin.
Excellent. And do you participate? What do you do for them?
For the most part, I am in charge of creating educational symposiums twice a year we put on a symposium. The last one we did, I believe, was on cholesterol medications and hypertension. And we had about 100 people come. We're always looking for new people to join the organization. And I think it's important that people of wherever they are in their nursing career, become affiliated with an association.
Great. And the last question, do you have any advice for current students enrolled in the MSN program and how they can help the future of healthcare?
Wow, that's a hard question. I do believe that the future of healthcare is going to be very different than what we're looking at now. I do believe that it's going to be more of a nursing, where we lack doctors. So being a patient advocate is always helpful. If we look around, the patients that I see in pre-open heart, their education regarding the medical, all the terms we use, I just think that we just need to be patient advocates at this point.
Great. Well, thank you so much for the interview.
You're welcome.
And for the advice. And this will be posted on YouTube, just to let you know, but in private setting.
Thank you.
Thank you.
Sure.